So you're very welcome today to the Bodywhys Eating Disorders Awareness Week webinar on navigating body changes through the life cycle. We have a wonderful lineup today of speakers who will address research relating to body image across the lifespan, and also two speakers who will outline their lived experience of body image, eating disorders, and their recovery journeys. And I think it's so vital to hear the perspectives of people who have come through eating disorders to a place of recovery and positive body image, and lessons learned along the way to provide hope and inspiration to others on their own recovery journey. So Eating Disorders Awareness Week 2024, and the title Navigating Body Changes Through the Life Cycle, and then the hashtag for the week is hashtag EDAW 2024. So the lineup for today is Julie Lee will speak first of all from a lived experience perspective. And I spoke to Julie yesterday, and just so powerful to hear Julie's story and just what she has come through and out the other side and really thriving. And I think that will really be inspiring for people. We also then have Dr. Sarah Cooney from University College Dublin, and Sarah will speak today about body image, menopause and chronic illness. Sarah will be followed by Bente Sommerfeldt, also from the research perspective, and Bente is from the University of Oslo in Norway, and she will speak today about eating disorders in pregnancy, relapse, and also worsening during pregnancy. And to finish today, then we will have Aoife O'Brien, also from a lived experience perspective. And I also spoke to Aoife yesterday as well. And again, just really heartening to hear Aoife's story, and just so powerful in terms of inspiring people on their own recovery journeys. We will have time then at the end for a Q&A session. I think it's very important as well just to say at this stage that although it's very much from a female perspective today, body image issues affect people of all ages and genders. And research indicates an increase in eating disorders and concerns about body image in men. Also increasingly in children, and very worryingly, we are seeing an increase in the number of preteen children in Ireland developing eating disorders, and the number of eating disorder hospital admissions for children and adolescents in Ireland continues to rise. So really, really important that we talk about these topics. In relation to young people and adolescents in particular, the Peace of My Mind report from last year from the Ombudsman for Children indicated that body image was identified as one of the top 5 mental health concerns for young people. 65% of the 2,166 young people surveyed, aged 12 to 17, reported body image concerns. So it's really important that we focus on these topics. It's really important that we listen to the research, that we listen to the lived experience, and that we all work together to promote positive body image and do what we can. So I think today is so important. And without further ado, I would like to introduce Julie. And just going to read the information that I have here, just to introduce Julie. Julie's life has encompassed diverse roles, from a successful corporate career as a European sales manager for an Irish multinational in her 20s, to the fulfilling role of motherhood with 2 wonderful sons in her 30s. Realizing that the corporate path didn't align with Julie's authentic self, she began a transition from the corporate world to studying psychotherapy at IICP College in Dublin in 2018. Julie works now as a trainee psychotherapist with a focus on providing support to individuals in emotional distress. Today, Julie will share her experience with body image and eating disorders throughout her life and her journey towards recovery. So you're very welcome today, Julie, and thank you so much for joining us. You're still on mute there, Julie.
Sorry.
Okay.
Thank you, Fiona. Can you hear me? Yeah, okay. So thank you so much, first of all, to Fiona and to Bodywhys for this opportunity to really share my story. I felt very excited at the prospect of speaking here and sharing my experience. So I feel really honored. So I just wanted to begin with that. So I guess my story starts very young age. I can remember as early as probably 7, 8, around 8. And I throughout my life, I would have suffered from bulimia and binge eating disorder. And that binge eating disorder, I can remember it would have started around 8, when I was 8. And I guess I had a quite difficult start to my life because I had, there were various traumas in my life. My mom had left me when I was a baby, which, you know, would have been very traumatic to a baby, 6-month-old baby. My father was an alcoholic, so he was very much absent. I was minded, basically, I was living with my grandma who was very, you know, very sort of hard woman. I would have never been, you know, touched or hugged or told that I was loved throughout my childhood. And there was a very heavy corporal punishments. So there were various things, and due to neglect as well, I would have been taken from my home, but nobody had realized that I was missing as a little child because I was left unsupervised for hours on end. So it was really difficult, and how that impacted me was that I felt incredibly lonely. I felt also very bored because I was at home all day by myself from the age of 5, 6, 7. And, you know, my grandmother would have left me you know, food for the day, and she would have been gone for the day. And out of boredom and loneliness, you know, the only thing that gave me comfort was food. So I remember my early memories of going into the fridge, opening, scanning the fridge, and just stuffing myself, stuffing my emotions. And from very young age, that relationship was established, you know, that the food meant comfort. And it carried on really well into my 20s. And so because of this binge, so that the binges were there from very young age, and it was a way of soothing myself. And that was the only way I knew how to soothe myself, really. So it began as a, you know, a coping mechanism for me, the only one that I knew. And because of that, my weight had, you know, I was borderline obese by the age of probably 10. And I was very much ashamed for my body weight. And when I was 10, my mom had come to take me with her at the age of 10. And it's then that began, you know, my weight became a topic of ridicule at social dinners. It was very much criticized. You know, I was constantly told that I was too fat from everybody around me, really. And whilst I was 8, 9, I wasn't aware. I wasn't really focused on my body at that age. We all know that as teenagers, you know, it's such a sensitive age. You know, I really started to feel that shame. And at one stage, I think around 12, I had decided that's it. I am not going to be that fat kid anymore. And so I began dieting. And when I mean dieting, it was extremely unhealthy, very restrictive, obsessively exercising. And I was determined not to be that fat kid. So I lost weight very, very fast. And how that was received and the feedback that I got from people around me was that, you know, that of validation, you know, everybody said, you know, you look amazing, you look fantastic, wow, you look so different. And because there was such a severe lack of validation throughout my life, and because of those traumas that had seriously impacted the sense of worth already, I very early at that stage started to equal my body image with my identity, my body image with my self-worth. So I very basically got the message, received the message that if I look good, then I'm acceptable and I'm lovable. If I am slim, then I'm amazing. But if I'm fat, I'm not good enough. So that's how it all started for me. And also just a sense of control and sense of accomplishment. I felt empowerment nearly watching that scale, the weight coming off. It really literally felt like that was the only thing that I could do, that I was successful at. And so I drew literally all my sense of worth from losing weight and looking slim and being slim. And what happened then is that and how the bulimia came in then is that at my core, I loved food. You know, I was a binge eater at the core. And I was fed up of not being able to enjoy food. but also I did not want to compromise on how I looked. So my answer to that was engaging in purging behavior. And so that it wouldn't affect my weight. And to begin with, it was very manageable. It was something that I engaged now and then, maybe once a week, once a couple of weeks, and I still felt quite in control. But then as the years went by and more stresses came about, I was 18, I left home. I had extremely successful career, which was driven by, again, the sense of not being good enough and having to prove myself. I started all these stresses, as these stresses became, it started to affect me more. The food started to go out of control, get out of control. And I started to feel out of control. And during my early 20s, I felt probably at the height of my eating disorder, my struggle, I felt completely worthless. I felt that I was constantly failing. I was caught in the cycle of, getting up on a Monday morning, I'm going to do it, I'm going to be good around food, and literally, probably failing, but 2 hours later, or what I perceived to be a failure. So I lost trust in myself. I constantly I didn't realize that it wasn't about self-will, that it wasn't about willpower. And therefore I believe that the problem was me, and there was such a harsh voices in my mind, why can't you just do it? Why can't you just not get a grip? And this carried on throughout the years, every single day. And I have very strong, very vivid memories of me even thinking, this feels so out of control. And I was aware that bulimia obviously can seriously impact your health, and that you can actually also, have end somebody's life, statistically. And even knowing that and still not being able to control my food and stop binging and purging was a really dark and desperate place to be in. I was engaging in something that could possibly have such a detrimental effect on me, but still not having feeling like I had no control over it. It was really hard. It impacted the sense of who I was, because, well, first of all, I couldn't be in any meaningful, authentic relationships with people because I had this persona that I portrayed to people. I was this successful career person. I was, I looked good, I was slim, and I was I was the center of the party, and I was outgoing, and everybody viewed me as a confident person. But beyond all of the mask, I just felt there was nothing. There was just a sense of worthlessness and a sense of being stuck. So I guess it went on like that for a few years, and I tried various things. And just to say as well that recovery hasn't been a straight line upwards, that it has been very much up and down. And I want to make sure that, I'm saying that because although I'm very, very well today, it took a long time to get here, a lot of trial and error. And, it wasn't, sometimes some things worked and sometimes things didn't work. And I guess what worked for me is, first of all, counseling was so critical in my recovery, first of all. And it was that my commitment to understand myself and my relationship to my eating disorder, because these disordered behaviors were just a symptom of what was going on for me. So for me to really, I was done with trying to control food. I really wanted to get to the root of it, what was underneath it. And counseling played such a huge part in that. And, exploring why I had certain thought patterns and why I felt certain way, why I behaved certain way, exploring all of that in counseling. So it was like a journey of self-discovery, really, understanding myself and why I did what I did. And in that also bringing the compassion around what brought me here and owning that story, and, understanding, for example, that I've been through so much trauma, and this is the only way that I could cope with. And that's the only thing that I knew how to do. So kind of letting go of a lot of shame around it as well, and understanding and more compassion for myself has been so critical to my journey. Understanding some of my characteristics, such as, perfectionism, very much black and white thinking, just different way of viewing myself and others, and relating to others. All of those have been very, very important. And for my body, I guess, realizing that it absolutely isn't all of who I am. It's only part of who I am. And also celebrating my body today for what it can, what it allows me to do, and what, you know, how it facilitates my life. And I always remember the example of, you know, it allows me, for example, to hug and kiss my kids. You know, so it plays such a beautiful part in my life. And so seeing my body from that perspective as well. Another thing that I guess helped me was, you know, counseling wasn't the only way. And I really want to say that as well. It was a more of an integrative approach. Even though I had 10 years of counseling behind me, for example, there was still things that I needed to look at, and those had to do with my body. I had to look at the effect of the eating disorder on my body. It had impacted, for example, my gut massively. And we know there's so much research around microbiome and the mental, you know, the link to mental health. So it was really, really important step, that part as well. And also doing something differently. There's a quote by Einstein that was so important for my recovery, which says the definition of insanity is doing something over and over again and expecting different results. And that really resonated with me. It's like, you know, I had to do something that was out of my comfort zone. I had to try things that was suggested to me, be open-minded and try something. If what I was doing wasn't working, I needed to be open-minded to, you know, to other things and try something different. And that can feel vulnerable. So I don't know what how I'm doing for time, but I guess just to end, I guess you know, I would like to just say that there's absolutely you know, from great pain comes so much learning and so much growth, and as much as we don't choose this path, recovery and healing is absolutely possible. And I just really want to reiterate that. And what recovery has given me today is such a strong sense of who I am. And the strong sense that I deserve to be here, I belong here, and I'm good enough. And those are the forefront of my recovery every day. And I guess I would like to end by saying that you're, you know, for anybody that is still struggling out there, that you're not alone. There are so many people that have walked this path before you. There can be such a great resource, you know, source of knowledge, expertise, insights, but also people that are walking this path with you right now, and they can give you so much solidarity and support. And I'd urge people to kind of reach out for help, because there's so much out there and you're not alone. And I'd like to end by saying that I'm also here for anybody that needs support. So yeah, I hope that was okay. Thank you.
That was just brilliant. Absolutely brilliant, Julie. So powerful. Your story is so powerful. It's so inspiring. And you touched on a number of things there at the end that I just feel are so important, that your recovery wasn't straightforward, you know, that it did take time, and you did have to kind of try different things and see what approach worked. And I suppose you touched on a lot of things on the eating disorder side, but also on the body image side, around kind of developing a more compassion towards your body, or focusing on body appreciation. And particularly what struck me was, you know, that your arms are for hugging, you know, and those kind of things that we do. Yeah, just so powerful. Thank you so much, Julie, for that.
Thank you.
And we will allow time then for people to ask questions of Julie and the panel towards the end. So thank you, Julie. And our next speaker today is Dr. Sarah Cooney. So you're very welcome, Sarah. Lovely to see you. Lovely to have you. Yeah, lovely to have you here. And thank you so much for joining us. I'd just like to introduce Sarah. So Dr. Sarah Cooney is a lecturer and assistant professor at the UCD School of Psychology. Sarah is an experimental psychologist with training in cognitive neuroscience and a primary research interest in body perception. The fundamental question that drives Sarah's research agenda is, how do we perceive our own and other people's bodies? Sarah directs the UCD Body Cognition Lab, which is located within the Affective, Behavioural and Cognitive Neuroscience research team at UCD Psychology. So today, Sarah is going to speak with us about body image during menopause and in chronic illness. So thank you, Sarah. So I'll hand over to you.
Thanks so much, Fiona. Can you hear me okay? So thanks for the invite today. It's wonderful to be here to listen to everyone speak, and thanks to Julie's for a really wonderful description of her own experience. And what really struck me there as well was your description of using your body to hug and kiss your children, which I suppose I'll tap into in a moment when I talk about functional appreciation of what our bodies can do. So today I'm going to talk about a couple of things. Mostly research conducted in the lab of late is focused on body image. So I'll talk about body image, but in particularly in relation to something called interoception, or our internal sense of our body. And I'm going to mention a few studies that have looked at this in relationship to women's experiences across different age cohorts, as well as more recent research where we've looked at the experience of menopause symptoms as they relate to positive and negative body image. And then a very recent study, which I hope to get onto if I have time, on multiple sclerosis and chronic conditions on body image. So just to get started on some definitions, so we all have a body image. It's in research, it's this really multifaceted construct that includes appearance-related thoughts, feelings, and behaviors. Negative body image is one concept or construct in body image, and it includes appearance-related concerns, but it also includes behaviors that involve shaming one's body. So the shame of not meeting certain ideal standards or generated standards, as well as the behavior of treating oneself as an object to be evaluated, looking at oneself from this third person point of view. Thanks. So yeah, as I was talking about, there's different concepts in body image, including negative and positive body image, and they're not mutually exclusive. So one can experience negative body image, so negative evaluation of one's body, while simultaneously experiencing positive body image or appreciation of one's functionality. And an awful lot of research has looked at one or the other of these rather than both of them in tandem. And just to go on to the next slide, one of the key areas of research that's kind of driving this research is that life does not end at 30. And the vast majority of body image research really focuses on both adolescence and young adulthood. And unfortunately, or fortunately, we live a lot longer than that. And women in particular go through really distinct epochs of biological change, from our monthly menstruation to many of us go through pregnancy and childbirth. And also the vast majority of women will go through peri and post menopause. And kind of in concert with this is the problems around the further we move from the kind of societally driven thin ideals of women in Western society in particular, the more vulnerable we are to experiencing body dissatisfaction. And this is kind of at odds with some of the social ideas around older women. The idea is that as we age, we have more responsibilities in the home and professional life, and therefore we suddenly don't care or are not affected by body image distress or concerns or even disturbances. And this really isn't the case, and that's what's been shown in current research and in previous research. So just going on to the next slide, what I am fascinated by for a long time is our sense of our internal bodies. So how we build a sense of our bodily self from the inside out. So one way to show this is to take a moment right now to feel your heartbeat without using your hands to check your pulse. And just notice yourself. Do you find that difficult to do or perhaps easy? Do you think if I hooked up an ECG to you now and tracked your heart rate, would you be able to directly guess your heart rate? And what's happening now is I'm asking you to get in tune with your internal body, and this is called interoception. So just moving on to the next slide, interoception is basically the sensing our internal viscera, sensing our internal bodies. And it's really processing these internal sensations, i.e. our respiration, our breath, our heart rate, and even our gastrointestinal cues, such as the feeling of fullness or emptiness. And these have been shown time and time again to be directly related to features of both body image and of eating disorders. So going on to the next slide, we can see that there's a really close relationship between lower internal sensitivity, so people who have kind of not so great at estimating their internal bodily sensations, are more likely to prioritize information external to ourselves, to prioritize our body image. So you see that people with lower internal body sensitivity tend to have higher levels of body dissatisfaction, and indeed people with anorexia nervosa, for example, tend to show quite low internal bodily sensitivity. So the idea here is that by promoting greater sensitivity or awareness of our internal body, we might be able to promote then things like positive body image, which might build a kind of resilience to the distressors of the visual of the negative body image. And just to the next slide. So this first study I'm going to talk about briefly was conducted by Aoife Narindas, who is my PhD student. And we were really interested here in looking at body image across different life stages in women. And we looked at body image disturbance, so really heightened negative body image across a bunch of characteristics in 4 different age groups of women. So just moving on to the next slide. And we were really wanted to know, do these components of self-objectification, surveillance, and dissatisfaction change as women get older? And does awareness of our internal bodily states change as women age? So the next slide just shows the methods, which was a massive online survey, which ended up having 1,200 participants with 300 women in each age group, from young adulthood, 18 to 24-year-olds. Remember, they're the group that have been looked at an awful lot in research. We also included 2 other groups from 25 to 39, 40 to 59, a really key stage in women's lives, and then older adults, 60 to 75-year-olds. And what we found on the next slide is, to take you to this briefly, is basically that on all components of negative body image, there on that kind of line graph on the left-hand side, bar 1, they all decreased as women got older. So negative body image, concerns about shape and weight over time, decreased as women age. However, when we asked women, how do you feel right now about your shape, weight, general appearance, there was an increase, sharp increase in this 40 to 60-year-old age group. And then on the other side of the screen, you see what our results from when we asked people about their internal bodily self, the noticing your bodily functions, noticing your heartbeat, being aware of them. And we see a sharp decline from the middle adulthood to older adulthood compared to their younger counterparts. So just going on to the next slide there. Similarly, we saw this association. So again, just to kind of confirm what previous research has showed us, that people with high internal sensitivity to their internal body are far more likely to have kind of lower levels of dissatisfaction. So not as concerned with their physical appearance in a negative way, or engage with self-surveillance or body shaming behaviors. So kind of the key take-home points on the next slide are illustrated there, that while body objectification and what's called trait body dissatisfaction, so feeling negative about your body over time, something that's kind of there for a long time, decreased from younger adulthood to olderhood, how you feel right now in your body increased from young adulthood to middle adulthood. And the same goes for a decrease in internal sensitivity to the body image. So from this, we were really interested in this 40-year-old to 60-year-old age group. And I suppose on the next slide, I'll explain why. So 40 to 60-year-olds is a key time for the experience of menopause, which the vast majority of women will go through. Menopause, the definition of menopause is the cessation of periods or menstruation for 12 months, more than 12 months. However, women can experience perimenopause for at least 7 years, sometimes more, before this stage. So that epoch of 40 to 60-year-olds is super important to examine body image. And the symptoms, which are on the next slide, are kind of immense. If you look at the HSC, you'll see this really massive variety of symptoms, but they can be kind of isolated or characterized by different titles. So the first is body changes or somatic changes. So one kind of very famous somatic change in menopausal symptom severity is the experience of a sudden heightened increased body temperature and associated sweating or hot flashes. Another less talked about one is the feeling that your chest is constricted and your heartbeat is moving much, much faster than you would expect it to be. There are really profound changes in mood and cognition, so particularly in memory and concentration, which have profound effects on people's professional lives, heightened irritability and lower mood, and then associated urinary and gynecological changes, which can include reduced libido, or result in reduced libido and increased UTIs, for example. So in this study, we were interested in these symptoms, the symptom severity, and we used a scale to measure it. And on the next slide, you can see that we measured the symptom severity and then wanted to see, does the level of symptom severity predict different features of the bodily self? So our bodily self is built up by things like our internal perceptions of our bodily functions, but also our positive and negative body images. And what we found on the results on the next slide are that higher levels of menopausal symptoms, so women who really kind of were experiencing really high levels of menopausal symptoms, irrespective of what age they were, importantly, predicted a decrease in their internal bodily state. So lower attention or awareness of, for example, your breathing rate was linked to higher menopausal symptoms. And likewise, the same kind of finding played out in body image measurements. So women with higher symptom severity also reported much higher body dissatisfaction. And then women with lower levels of menopause symptoms conversely predicted greater body appreciation. So the appreciation of what your body is, irrespective of whether it aligns with kind of societal ideals. And on the next slide, the implications for this, I think, are quite important, because this is an age group that's often overlooked in research in general, but thankfully this is changing. We've shown here that the menopausal symptom severity is a really significant part of the course of a woman's life, and particularly it can moderate or change a woman's bodily self-image. So it's really important that we enhance positive body image and awareness of and attention toward the inner body. And one thing that's striking is that there's very limited randomized control trials of evidence-based interventions for these types of practices. And so that's something to really look at in the future with research. And then finally, I hope I have a couple of minutes, if that's okay, Fiona. I know there was a bit of a delay there to talk about chronic illness and body image. So this is a great study that I was fortunate enough to be part of, where it was run by a clinical neuropsychologist whose specialty, Fiona O'Keefe, is in multiple sclerosis, and an association of multiple sclerosis were also involved. And we had public and patient involvement from the outset. And one of the key kind of descriptions of people with multiple sclerosis was a reduction in quality of life, that a key feature of this being a reduction in sexual functioning. So just on to the next slide there. Thanks, Barry. So multiple sclerosis, if you're not familiar, is a chronic neurological autoimmune disease of the central nervous system. It has a variety of symptoms and disease progressions. It has a bunch of cognitive, physical, and psychological symptoms, and they're very individually variable, but they can have detrimental effects on quality of life. So despite the prevalence of sexual dysfunction in people with MS, there's very few studies that explore the relationship between sexual dysfunction, body image, and quality of life. And we know from other studies with people without MS that people who have a positive body image, a body appreciation, are far more likely to have kind of a sexual functioning than those who do not. So the next slide just illustrates what we looked at in this study. So some previous research kind of limited to chronic pain and fibromyalgia has shown that these sorts of chronic illnesses show an increased susceptibility to body image disturbance. And one lovely study recently by Aoife and colleagues has showed that if you promote body functionality, you can see a reduction in the depressive symptoms associated with rheumatoid arthritis. Notwithstanding this fantastic research, really, really a paucity of research in chronic illness and body image. So we explored positive body image in the context of chronic disease and interoception. And the next slide just shows the method. So we explored the bodily experience of psychological well-being in people with MS to better understand the factors contributing to the higher prevalence of sexual dysfunction reported in people with MS. And we found on the next slide, thanks Barry, we compared 104 people with MS who were from the ground level involved in the design of this study and the features of this study, and compared them to people without multiple sclerosis. And we gave them measurements of sexual functioning, dimensions of body image, a whole gamut of mood and quality of life measures as well. And the results showed on the next slide there that, as we suspected, people with MS showed significantly lower reports of body appreciation, much higher negative body image, really significant lower attention towards and awareness of the internal body, higher levels of anxiety and depression, and overall poor quality of life. And all of these features or facets were associated with sexual dysfunction. And importantly as well, that when we think about body appreciation, neither body appreciation or poor body image or negative body image were associated with the severity of the disability or the illness duration. And just some take-home points, I know I'm running out of time a little bit here on the next slide, is that the thing that really kind of strikes me is that our bodily self is generated from the inside out, and if we focus too much attention on the external cues, we lose a sense of ourselves from the internal. And we can kind of use what research has found to kind of develop carefully designed interventions that are evidence-based to direct awareness and build attention towards our internal body. And from this, we can build positive body image. And by doing this, we can then not diminish or reduce or eliminate negative body image, because it can often just be there, coming in and out of, waxing and waning through our lives, but it can redirect attention towards the inner body. This may bolster resilience to the experience of negative body image. So I just wanted to thank the invitation from Bodywhys today to give a talk, and to everybody in the lab. On the next page, there's a thank you, and the references that I've used are all in the last couple of slides there, should anyone want to do some reading. Thanks very much for your patience there. I know I was a bit stalled at the beginning. Thanks.
That's great. Thank you very much, Sarah, for that very interesting presentation. Yeah, and I suppose I find the interoception research really fascinating. I suppose there's so much possibility. It offers so much possibility in terms of, ways to promote positive body image or improve body image in people. So very, very interesting. And of course, the body appreciation aspect as well. So thank you so much for joining us, Sarah. And if people if people have any questions for Sarah, again, you can put those in the Q&A, and we will get to those at the end. So moving on to our next researcher, Bente Sommerfeldt. And thank you so much for joining us today, Bente.
Thank you for inviting me and being able to share some of my research I have been doing on pregnancy and motherhood in women with a history of eating disorders.
Yes.
I think Yeah.
So I'm really looking forward to hearing your research, Bente. And I just have a brief introduction. So Bente Sommerfeldt is a clinical specialist in psychology and PhD researcher. Bente is the academic director for Foundation Institute of Eating Disorders in Oslo in Norway. Bente has a long clinical career in working with eating disorders, and over the last 5 years, she has been researching eating disorders in pregnant and new mothers. Today, Bente is going to share research about relapse and worsening of eating disorders during pregnancy. So thank you, Bente. I will hand over to you.
Thank you. As you said, I will say something about the relapse and some of the experience that I have been talking to several women that has been pregnant and being also new mothers, and I've been following them through pregnancy and birth and after birth. And my focus here is now on the relapse and worsening and how they experience the pregnancy period. But I just also wanted to emphasize, and I will say something about that in the end, that pregnancy and early motherhood is also a very important phase in woman's life that also is high risk, but is at the same time, high risk periods is also a very important time for changing. And it's also a period of time where we are vulnerable for changes, both in positive ways and also in negative ways. So that's why I'm today emphasizing the high risk, but I will also thank the other presentations for emphasizing how also the focusing on the internal body and also the positive ways of accepting the bodies and how the body actually can give birth and bring another woman in, another person into life is a very important place also for changes that I also have talked to several women that have experienced this period, also a way of accepting their bodies. So just not thinking of high risk is a negative thing, but it also could be a positive thing. But people need support and help to go through, and also focusing more on the internal and maybe using the baby inside to be able to connect to your body. I will say something more about that. So being in a negative way or in the high risk, I think it's important just to remember that women especially goes through 2 periods in life where we change more than ever, and that's in the adolescence, and that's a high risk for several mental health issues and also eating disorders. And the next period in life for women especially is pregnancy. That's the second time and the second phase in our lives where the body are changing. And they were talking about menopause, that's also a changing in life, but also being pregnant is a lot of changes that you're not able to control in a way. And that's something I will say, how do women with a history of eating disorder experience this period of life when the body is out of control in a way? And we know that pregnancy and early motherhood is a high risk time for not just eating disorders, but also for psychosis. Bipolar disorder, maybe also because of the medication is more complicated, and depression, postpartum depression, and several women with eating disorder history is also more vulnerable for postpartum depression than other women, and anxiety also. And eating disorders is much more common than what we want it to be. If you think in Norway is a little country, but I think we have around 60,000 births a year. And of those 60,000 women, around 8,000 women struggle with their bodies through this phase of life. That's high numbers. And it's so high numbers that it's surprising that we don't do anything more to help women through this phase in life. Because if we could have more help and more support through a period of 1,000 days from conceptions to birth and after birth, we know that we also could prevent a lot of relapses, because we know that this is a time where a lot of anxiety and worries about your body is in a way reawakening. And if you could get some more help to, for example, be more internal focus in a positive way, connecting to your baby throughout the pregnancy and after birth, this could help to prevent a relapse. And that's what also the women which I have talked to through my research have told me, that they should wish that people were asking them about more of their experiencing all of these changes through the body and not just telling them everything that's normal, but also asking, because if they got the questions, they will be more aware of their bodily experiences. So that's just a reminder for us health personnel that ask, how is it with your body right now? And we are living in a time where it's not possible not being able to have a lot of focus on the external part. And just looking at some of the pictures here and the magazines, it's very difficult to be pregnant in these days because we have so much focus on the external body and the external way of the right way to look, or the right way to gain weight, and also the focus on how to get your weight, your body back again after birth. And this is also something that a lot of the women is telling me, that there are maybe putting something on pause through pregnancy, but they are making a lot of plans on how to get their body back afterwards. And all this planning is in a way of reminding them of how the eating disorder was working for years back when they had an eating disorders, that they were doing a lot of planning and having a lot of the ideal body. And we know that it's a high risk for body dissatisfaction if you're having an ideal body, that you want another body you want to achieve. And that also put the women in more risk to be more dissatisfied, because it's very often a goal that is not possible to reach, because you always want to have another body and then what you have. So that's what I've been trying to find more about, how this period of pregnancy and the early motherhood is experienced by the mothers, by the women themselves. So I have talked to 24 women with a history of eating disorders, and the woman that I have been talking to in this study is having a history with bulimia and anorexia. No women with binge eating disorders were I didn't reach any of those, and I think that one answer to that is it's a lot of shame, and it's also a diagnosis that is not that well known and well accepted in Norway yet. And I was trying to talk to them and try to find out how they experienced this period of life, and how this understanding can help us to detect, not at least, and also prevent relapses, and try to develop more interventions that actually is tailored to these problems that they are experiencing. And what I found was one very clear fact, is that pregnancy is not a time to improve necessarily if you don't have the right help and support. It's also a time for relapse. So 23 of the 24 women I talked to during pregnancy experienced a relapse in their eating problems. And a very high, it was the loss of control in very many domains. That was like the overall trigger, but I will say something more about the triggers. But a loss of control in both emotions, relations, hormones, and the body, and the physical body, as well as the emotional body. And this also, another thing that was a very clear trigger, and I wasn't that aware of it before I talked to these women, but is that our health approaches during the perinatal mental health follow-up in Norway and in the Scandinavian and also in England is kind of look like an eating disorders. And if you have been in treatment for eating disorders, you have probably been focusing on what to eat and trying to be more flexible in eating, but you have maybe have some nutritional plans, and you have been maybe weighing yourself, or your therapist has been weighing you and trying to work on to reduce your underweight, for example. And suddenly when you get pregnant, you can suddenly experience this again. The health professionals, they are again starting to weigh you, and they're again giving you advice on what's the right thing to eat and what's not, what you not could be able to eat. So it's a right and wrong things. and with starting to measure you and how much you gain weight from each time you meet your nutritionist or your doctor. And all this focus on the concreteness and the measurements and the numbers and the figures and the right and wrong could be that it looks like a lot of the treatment that you have been experienced before. So that's an overall experience from all the women I've been talking to, that we should be aware of how we actually talk about the body also in the follow-up and when we support women in pregnancy. So I'll just try to summarize some of the experiencing that these women that I have been talking to have been when they've been describing the worsening and relapse through pregnancy. And I've been using a little unusual approach and trying to summarize 24 women's experiencing and into 7, in a way, clusters. And these clusters have been named as a mother with different names. So it's not one mother that represents one of these cases, it's 7 mothers that represents one experience in a way. So that's an article, and you can also have this, get all this from me. And it's 7 descriptions of ideal types that these mothers summarize. And one of the triggers that has been described is a mother that experienced a lot of chaos through pregnancy. And this is women that has a history of bulimia and severe bulimia. That means over 10 years of treatment. And they have a history of improvement before pregnancy, but they experience, when they get pregnant, they experience that all these changes that they go through and all the loss of routines that maybe have been feeling of security represent chaos. And this chaos is very similar to how they experienced their period with bulimia, where they lost control over both the food and the body. So this trigger is the loss of control, and it happens then also that the trigger is that it starts out with binging. You start out to lose control, and you start with a lot of purging again, and you feel like you're going into the same cycle that you have been experienced before, the vicious cycle that you cannot be able to stop in a way, because it's a mixture of hormones and it's a mixture of chaos, and it's you don't feel that you can control it. So you're in a way starting to feel that maybe I can start to control it after pregnancy. So the trigger, loss of control with a chaotic mother, and there's a lot of impulsivity here. A second cluster is the more rigid mother. And here is a history of anorexia. And before they get pregnant, they also have a normal weight, but it's in the lower reach. And several of these women has also gone through IVF, in vitro fertilization. And they have never been asked through that process about their weight and how they experience their body. So that's also something that I think it's something that we should be more aware of actually the bodily awareness. And they experience that the pregnancy is again returning with the restrictive and picky, and getting less and less food that you could approve to be eating. So the pregnancy represents a return to rules and strict routines and a lot of yes and no food, and you start counting and measuring. And this is something that also health personnel is in a way helping them with, because they also count, measures, and say yes and no to things. And all these unpredictable changes for these women is in a way returning them to this restrict regime of a lot of routines they have to follow, in a way, trying to get control when they don't feel control. And we have the third mother, and this is more like the perfectionism. And the perfectionism is a trait that could be both in a positive way and also in a negative way. And a lot of these women in pregnancy that experience relapse experience after birth an improvement. So that's also an important thing to keep in mind, how we can help people during pregnancy to actually improve afterwards. But what they are experiencing during pregnancy is that it's a lot of competitiveness, and it's a lot of comparing themselves with other pregnant women, and not just newspapers and magazines, but also friends and close people, and also their own mothers' histories of how their pregnancy were, and their stories about that. So this really struggling for the thin pregnant, the perfect pregnant, and the thin mother to be. And the problem here is also that they're getting a lot of good validations from health professionals that they're in good shape during pregnancy. This is great. Keep on working, keep on exercising throughout the whole pregnancy. So in this way, they are getting what also we talked about earlier today, that in the beginning of an eating disorders, you very often get positive comments, and that in a way give you a feeling of mastery. And this is also what the pregnant woman in this group is saying, that they're getting a lot of positive achievements in a way from also the health professionals, because they're getting through pregnancy, not gaining that much weight, but enough weight. So they're doing it in the right way in a way. But the triggers for these women is the performance anxiety. They're really struggling to do it the right way and the perfect way. The fourth category, the worried mother, this is a lot of the similar thing that Julia was talking about the lack of interoceptive awareness. This is a woman that struggles with pregnancy because they're not aware of their inner body and their inner awareness, and they're not feeling attachment to the body inside either. So when the people are telling that, tell me if you feel something different, then you should contact the health professionals, for example. They're getting very scared because they're feeling in a way detached from the bodily feelings. So they don't feel that. They need help to get in a way attached again to the inner body. So this is like the hyper-embodied and the disembodied at the same time. They're thinking a lot of their bodies, but they're in a way disembodied. They're not in connection. So they will have a lot of helpful interventions if we could help them to be more aware of the interoceptive awareness in a way. And this is the anxiety for not being good enough mother, and also being not liked because of the bodily changes from their partner. So this is a lot of worries. So the trigger here is the changes in their parents, and also the decreased attentions and confirmations from others, in combination with the detachment of their inner body. And the fifth one is the mother who fears motherhood. And here is also a history of anorexia. And very many of these women have been told that because of your anorexia nervosa, you're not able to be pregnant. And we should be very careful about telling people that, because we know that people with a history of eating disorder is as able as other women to be pregnant, as long as their body weight is normal. And this is also a group of women that is experiencing the pregnancy as a shock. So they're getting unexpected pregnant. And in a way, the eating disorder has been a function of protecting them from having responsibility and obligations from others, and also a sense of immaturity in a way. They're not ready to be a mother, and they're not ready to attach to a child. So the fear or expectations of being a responsible mother is something that they're struggling with during pregnancy. And the sixth group is the mother with the lost identity. And the illness with eating disorders has through years developed into her identity. I'm the thin girl, the thin woman, and I'm the fit one, I'm the trained one. And then the pregnancy represents a loss of identity marker. Who am I now? In all these changes, I don't know who I am anymore. So this picture is like, in a way, a picture that I very often use when I work with eating disorders, is that they very often have a feeling of how they look, and they often have a feeling of being bigger than they are, and they always very often have an ideal of how they want to look. But if you ask them who they are, they're very often confused and say, I don't know. And this is very closely connected to interoceptive confusion, but also to the loss of identity. So this is what some of the women is struggling with, the loss of identity and the confusion of who am I now when I'm losing this way of being fit and the thin one. The seventh group is the shameful mothers, and here is more of a history with bulimia and also some physical or sexual abuse in some of them. And when very many of these women have been experiencing a lot of shame and also body shame because of what they have been experiencing. And they have been working with that in treatment, but experienced all these physical changes through pregnancy, and especially maybe the nausea and vomiting early in pregnancy triggers in a way a restart on binging and purging. And also that as a functioning of dealing with all this anger through the loss of control of their body, and also the self-punishment because they think that they don't deserve to be a good mother, or they don't deserve to be a mother because of what they have been experiencing. So this is also something that is similar to the chaotic mother, but it's a lot more of the shame part here. So I think also working with these mothers about acceptance is very important. So what we have learned from these women is more that it's not that the weight gain itself or the changing body itself or all these different things that the body goes through, but it's how they actually is experiencing this and how they put the meaning to these changes. And that comes back to their eating disorders function in a way, how they deal with the loss of control, and how the eating disorders maybe earlier on have helped them to deal with all this loss of control, and in a way trying to take control when you don't have the inner control. And that's also what these women is telling us, is that some are more vulnerable, going back to some strategies that has been functioning before, and also together with the personal traits like perfectionism, rigidity, impulsivity, or some trauma history could make you more vulnerable in a way to go back to the strategies that the eating disorders has been. So what the women are telling me and telling us is that they wish that we had more competence in asking all this bodily experiencing and how they deal with this. And they want us not to be very quickly to say that when you are a lot of nausea or you're throwing up, saying that that's normal, or if you are afraid of all this changing, very often health personnel is saying that, but that's normal. So a lot of things in pregnancy is normal. But what these women say, that when they hear normal, they feel very bad because they know that this is not normal, because this is a lot of these things I did when I was sick, and this is actually pathology. So they know in a way that they're doing things that they shouldn't do. So they feel that we are bagatellizing or not taking them seriously in a way. So they want us to be more directly. They want us to ask how they feel about their bodies. They want us to ask what they're worried about. They want us to ask if they are worried about how this is going to affect the children, not just saying that this is not going to happen. Because all the women I have talked to have also experienced that their own mothers have been struggling with their bodies, for example. So this is something that they are very afraid of giving further to their own child. So it's a highly motivated group of women that is really needing and wanting and asking for more specific help to intervene. So do not recommend a pause in treatment during pregnancy. I think that's a way of actually helping the mother, but also helping the children to be able to have a better relations to their bodies, because a lot of things is happening in the first 8 years in life, also for these children. So it's an important period for change in a good way and in a bad way, as I've been describing. This is also an optimal situation for interventions during pregnancy and during the first year after pregnancy. And all mothers are motivated for doing things in the best ways. And that's also why we should be more aware of how all this bodily awareness, but also acceptance, is a very good way of helping women to accept that, yes, your arm should be used to hug your children, and not being too focused on the external body. And we also know that if the mother is having a better relation to her body, that's also affecting the body to the mental health for the child. We know a lot about that. And that's not to give any guilt or shame to women today or mothers today, but I think it's a very important part also to accept that you're an important person, but also another person's life, not just your own life. So we have to be more curious about the many possible phenotypes we meet, and also how to be able to intervene and tailor the interventions to what the woman is actually asking for. So that's my favorite phrase, is curiosity by proxy. So if we are more curious about how the body, for example, is experienced during this phase of life, is also able to be curious by us. So helping also the women to be more curious about the interoceptive awareness of their own body. So embrace the complexity and not trying to make it too simple. I think that was about what I was able to say.
Thank you, Bente. And I suppose, you know, I think you raised something very important there, that if a person is experiencing body image concerns or a return of any eating disorder symptoms during pregnancy, it is really important that they are aware that there are lots of supports available, and that they would seek to get support as early as possible, you know, for their own well-being, so that they can look after themselves physically and mentally, and enjoy what should be, you know, which is a very important period of their lives, and obviously support the well-being and physical and, you know, all aspects of the health of the child as well. So I will put up obviously the Bodywhys supports at the end of today's webinar as well. So thank you so much, Bente. And moving on now to Aoife. So thank you, Aoife. Thank you so much for joining us today. Lovely to have you here. And
Thanks, Fiona.
yeah, and it was lovely to chat to you yesterday as well. So just going to read through the introduction that I have for you, Aoife, before you start. Aoife O'Brien is 34 and lives in County Clare with her partner Damien and her two boys, Liam and Samuel. And throughout her late teens and 20s, Aoife felt she was controlled by an eating disorder, which went unnoticed for a very long time. Now, having fully recovered, she is passionate about getting the message out that life after disordered eating is very much possible. Aoife is going to speak with us today about her experiences throughout her life. So thanks so much, Aoife, and I will hand over to you.
Thanks, Fiona, and thanks to the great speakers before me. It was very interesting. So yeah, I suppose what I'm going to talk to you about, and I could talk for days about this topic because I'm very passionate about it. So I'm going to try, and I suppose within the 15 minutes, tell you a bit about my story, my journey, and then I really want to finish then with some practical tools for people that might be struggling on how things that help me, I suppose, navigate changes throughout your recovery and throughout life. So yeah, like Julie, actually, my earliest memories from about 7 or 8 years old as well. Interestingly, so yeah, it was going back. I was having a sleepover camping with girls from my class in primary school. And it kind of blows my mind to think back that I was 7 or 8, that I actually thought this. It's only on reflection that I'm wowed by it. But that I suppose that's when my awareness, I suppose, around body image in a negative way, that's my first memory of it. And I can remember getting ready, going to the sleepover and packing my pajamas. And I can remember feeling proud that my pajamas said size 6 to 7. And I think I was 7 or 8. And I really wanted to highlight that to my friends at the sleepover, and it's just so sad, I suppose, to think of a 7 or 8-year-old actually having that awareness, and to have had that understanding that a smaller body was better from such a young age. And when I think back, it wasn't that anyone had said to me that you need to have a smaller body at that age. I think it was very much from hearing the messages around me, particularly I suppose from adults or from older family, relatives, things like that, like around, I suppose they're talking about their own bodies and how they wanted their bodies to be smaller and how they wanted to be on a diet. And I think it's important to mention it because, and it's not from a shaming purpose either, but we can't think that, oh, just because I'm focusing on my own diet, that my kids don't hear this. Like by osmosis, I was taking that in, even though no one was directly saying that to me. And I suppose I'm so grateful for my own recovery now, I suppose, as a mom to 2 young boys that are 1 and 4, that I'm so grateful that in my family that I've built, that conversation will never be there. It just wouldn't be part of the dialogue in our house, thankfully. So I just think it was just important to mention that, I suppose. And growing up then, I suppose that my first, I suppose, experience, I suppose, of the eating disorder really manifesting in terms of food and exercise and stuff wasn't until my late teens, early 20s. But like on reflection, looking back, like throughout my younger life, there was definitely, I suppose, things there, but I suppose it just hadn't manifested physically in terms of using food as a coping mechanism until later in life. But I suppose looking back, my self-esteem would have been very low growing up. I always, I suppose, compared my body to other people, and I suppose I was aware that my body was a bit bigger than my sisters or my friends. I always had that awareness there. But I suppose there was a lot of tendencies around perfectionism, very studious, put a lot of pressure on myself. Didn't really enjoy sports, I suppose, going through puberty, and just didn't like the pressure of it. So they were things that when I look back on, before I started using food, I suppose, before the eating disorder developed, there are things that I kind of look back on and see were kind of maybe signs, I suppose. But it wasn't then until I joined slimming groups, I suppose, from in my later teens, that's when I suppose I found like those groups really like gave me the tools, I suppose, to for the eating disorder to develop, I suppose, because I started understanding about calories and food groups and how to lose weight. And I suppose it really thrived from there for me then. And I suppose that's when the real obsession kicked in terms of monitoring what I ate. There was really, really strict and rigid food rules that I had. And it did totally come over and consume my life 24 hours a day. And it was very much, I suppose, that black or white thinking. I think Julie mentioned it earlier, like there was good food, there's bad food. I was good if I had this, I was bad if I did that. There was no in between. And I think what I find interesting looking back on it as well is that I suppose I mentioned earlier that I was slightly bigger than other people when I was younger. And then I suppose, and that there would have been comments made about that growing up, I suppose, more like in secondary school and stuff like that, from, I don't know, boys at discos and friends and all that kind of stuff. But it was then when, I suppose, when I started losing weight like that, and it was mentioned a few times, all that praise came in that I was doing great, I was looking fantastic. And it really just cemented, I suppose, what I already thought was thinner is better. And I suppose it just kind of reinforced that when I was getting those messages and I was getting lots of praise. And I think as well for me, no matter how much kind of weight I lost, I suppose the goalpost always moved. It was never, once I get there, that's enough. Once I do that, that's enough. It was always moved. It was always more, more, more. And my view of myself, I suppose, was so distorted. I couldn't see what I actually looked like. It was very distorted. And just there was a lot of obsession there. And I think like I don't focus on any of the weight-centric measurements like BMI or anything like that. But I suppose I just wanted to mention it, that I did move into a normal weight category when I was at my sickest. And I suppose then that was why I suppose it went so unnoticed too, because it's celebrated. I suppose weight loss is celebrated in society no matter what the cost, you know. And it was, oh, you're so disciplined, you're so great, like, but it was really, it consumed my life all the time. And like I think, I suppose I dabbled with lots of different, with labels as well. I don't really find I identifying too much because I suppose I dabbled with all the different labels of the eating disorder. So I kind of don't feel like I fit into a category, I suppose, but I had behaviors of all of them. And yeah, I suppose it's just the food and exercise, and I suppose over exercising and punishing my body and all that, that just became my norm. And like I never knew. I knew it was kind of a bit weird in the fact that it was so stressful to maintain that all the time because it was so rigid. If anything changed, like I would totally micromanage my body every minute of the day. I would plan out what I was going to do, what I was going to eat, exactly what I was going to do at work, everything like that. And if anything got in the way, I just found I couldn't cope with it. Like I found that really, really stressful if anything got in the way, that it was very rigid. And I think even likewise, when I was thinking back, like my alcohol intake was kind of on a parallel journey as well. The alcohol was very up or down, all or nothing, black or white, and very, I suppose, a lot of binge drinking, I suppose, as well. So it was kind of, my recovery with food and alcohol kind of seemed to follow the same parallel journey as well. But and I think because, and I know it's kind of similar to what Julie had said earlier, like I suppose that became my identity because I was known then for like, okay, you're really good at doing that. You're the girl that's really good at nutrition and exercise. And I embarked on my master's in nutrition and dietetics masters, and like it just really did consume me, I suppose, internally and then externally, because I was working in weight loss clinics. I was giving those tools to other people. Like it just really consumed me, I suppose. And that was going on for a long time throughout my 20s. And then I think I just kind of hit the stage where I just felt like I needed support. Again, I wasn't fully aware that I even had an eating disorder because I thought this was normal behavior. And I suppose I wasn't really pulled on it much either. I'm sure I know I was very difficult to be around because I was so obsessed, but and very judgmental of my body and other people's bodies. And see, I thought maybe other people were lazy if they weren't doing what I was doing. I didn't realize how warped it was what I was doing and how detrimental it was. So I suppose the reason I kind of looked for help at the time was it was just my baseline level of coping mechanism was very, very low. Dealing with like a breakup with my partner at the time, challenges at work. I felt like there was just so much pressure, and I found then that I just felt like I wasn't really coping day to day. So I ended up going for counselling and working through that. I suppose it came to the fore that it was the counsellor dealing was like, this isn't really my area. It seems to be eating disorder, she thought. So then anyway, I went and I sought group support initially. And I just think it was the most amazing thing that I had ever done for recovery. I can remember just walking in the door and I was dreading going in because I thought, oh my God, an eating disorder recovery group, it's going to be full of lunatics. I like don't think I really need to be here, but I'm going to give it a go. But I can remember like as soon as I went in and just hearing other people speak the things that I thought were mad in my head, and just instantly feeling like, oh my God, I'm in the right place finally. I just feel like I connected with everything that was said there, and it was so magical, and I can still remember it so well. And likewise, even when I hear Julie speaking, I'm just like, I could relate to so much what she was saying. So when I was in that group, there was people of all different stages that were fully covered, fully free, middle of the road, early days like myself. So I could see people in front of me that had gone through it and they were flourishing, and that was really hopeful for me. And I felt like I just trusted the process pretty early days, and I suppose my alternative was keep going the way I was going, and that wasn't getting me anywhere. So I kind of knew, okay, this is where I need to be, and I trusted in that. And I think from the early days, what really helped me was in recovery, like to dissociate, I suppose, myself from the eating disorder. Was that, okay, this is Aoife, this is the eating disorder behavior and the thought process and everything like that. And I want to figure out who Aoife is, look beneath the surface and see what's actually going on for her, not just the exercise, nutrition, whatever it was. So that was really helpful for me. And when I was being really, really harsh to myself, like anyone who's gone through it, know you would speak so harshly to yourself that it's awful. And like I could kind of say, look, okay, no, that's not my beliefs. That's the ED. It's not actually what Aoife thinks. So I found that really helpful in the early days. And I found by then parking as well, food behaviors and just focusing on what was beneath the surface, eventually they gradually disappeared bit by bit. Now, it wasn't easy. It didn't happen overnight. It was a long process, and it did require a lot of action on my behalf and trusting in my practitioners at the time as well. But I found maybe some practical tools that maybe helped me along the way, I think I will focus on as well. And I want to touch, if I have time as well, a bit on my pregnancy and postpartum journey as well, because I suppose it's been a big part of my recovery process as well. So stop me, Fiona, if I'm going over time. But I suppose for me, it was change. I was very fearful of any change. It wasn't just my body changing, it was change in general. I just found that really challenging and really difficult to deal with. And I can't really disassociate the two. I feel like I can't separate like my body changing without changing life. I was changing because I was learning who I was. I was learning things about myself. So obviously my body was changing at the same time. It was all parallel. I can't, I suppose, separate the two from that. But I found it really useful in the early days, I suppose. Just kind of some practical things was, I just have them wrote down here, So I used to cut off the labels in my clothes when my body was changing size. And I used to just tell myself that, like, okay, I want to be comfortable. I don't need to, it doesn't matter what the size is. I just want to be comfortable. And like, I was getting help around that from my practitioner of navigating through that as well. But that the size didn't really matter. And I just wanted to be comfortable and not wearing tight clothes, because that would really kind of trigger thoughts in my mind as well. I threw out my weighing scales from the very first day. And this is someone who used to weigh herself numerous times a day. And I threw them out that first day, and I never actually weighed myself again. And it was funny when Bente, sorry, I don't know if I'm pronouncing your name right, was talking about the weighing in pregnancy. And I can remember at the time I used to actually ask my GP, can I turn around, because I don't want to look at it. But I felt like I had gone through recovery for a few years that stage, that I felt empowered and confident enough to say, like, I don't actually care what's on the scale, you know. And I felt grateful that I could voice my own concern in that sense. But it didn't bother me, I suppose, when I got to that stage. I was a few years in. But sorry, I lost my trail of thought there. Oh yeah, so I'd thrown out the weighing scale and just committed to never doing that again, never weighing myself again. I used to focus on every time I would go past a certain point, whether it was my walk to work, my walk home, or going into the bathroom at work, I would focus on 3 things that I like about myself, and I would just say them to myself throughout the day to keep me going. And I thought that was really powerful. And they might seem silly at the start. I was like, I'm not doing this, it's so babyish. It was like the intellect just despised those practical, simple tools, which a lot of the recovery stuff is. It's not easy, but they're very practical and simple. And I suppose it's not to overcomplicate them. I can remember looking in a mirror and saying I wanted to write down what I actually like about myself. And I can remember breaking down crying. And like, I just found it so hard to actually like believe that or verbalize that. And then even looking at my qualities, what did I like about myself as a person? And that might seem common sense for someone who maybe hasn't gone through something like this, but like, that was so difficult, but really worthwhile doing it. I used to write a letter to my body on regular occasions, which was very powerful as well, I found, and just helping me connect with my body, that like, it wasn't just for show, it wasn't just an ornament, that it was an instrument for my living as well. I used to save a screensaver of my younger self on my phone as well, and just say, like, how would what did she need at the time? And I started kind of self-parenting myself with that. I used to say the harsh things out loud to myself so I could actually hear it, stop myself, apologize to my body, and kind of reframe it. I used to set boundaries with people around me, around not talking around diets and stuff like that. And that was mainly because I used to be the ringleader of those conversations. So I really had to set those boundaries with my friends and family. And that was really, really helpful. And just, I suppose, experimenting with clothing and styles and what I was comfortable with. And that kind of helped as well. And I suppose, just to kind of wrap it up then, I suppose that that recovery is possible. I always love to give that message, and like, I would, like, one of my favorite quotes is, be the change you want to see in the world, and that recovery is possible. It does take work and it takes time, but it's so worth it. And especially moving in, like, I'm a parent now, as I said, and like, I'm just so grateful that I learned those tools before I became a parent. And that might be the way it works out for everybody, but it was for me. And I found my pregnancy definitely deepened my recovery journey in terms of accepting my body. And I used to fear becoming a mom or being married or anything like that, because it would change my appearance. I despised the idea of anything like that. It would interfere with my career. And it was the complete opposite, I suppose. Then when it happened, I did embrace it and I enjoyed my pregnancy. And it's just really nice just knowing that, I suppose, that what I believe in now is very different, and what I can pass on to my kids, like age appropriate ways that they can respect their body, listen to their tummies. Is your tummy full? Do you need more food? It's not clear the plate. There's things like that, I suppose, I find is so empowering to pass on to my kids. But I'm going to wrap it up there because I know I'm stuck for time. So thanks very much, and I hope you enjoyed my talk.
Thank you so much. Thank you so much. That was so powerful. And, I suppose you've touched on so many things there, Aoife, and you really provided such practical suggestions for people on their own recovery journey. And I suppose one thing that really kind of stuck out for me there was, just in terms of bring in, and Julie, you mentioned this as well, about kind of reducing the focus on body image, you know, and is around kind of creating, like discovering who is Aoife, you know, and creating that kind of bigger picture, and getting to know yourself again and building up all of those different aspects of your life. And I suppose that they are so important. And just those very practical tips for people there, as well, instead of, you know, in terms of navigating the changes to maybe their body as they are on the road to recovery, and really practical advice there around building up a more positive view of yourself as well. So just all so valuable, and so inspiring. So really appreciate that. We are going to move to, and thank you all. It's been just such a great overview, and will be so helpful to people. And what I'm going to do now is I'm just going to put up information about the Bodywhys support services, and then I will take the Q&As, and you know, just in case some people have to leave maybe and can't stay for all the Q&As, that at least you will see some of the services that Bodywhys offer. And I suppose so important to finish on that message as well, that recovery is possible. Everybody has said it at some stage. Recovery is possible, and that you are not alone, and that there are lots and lots of supports available, no matter what stage you are at, either in the depths of you know, really challenging eating disorder, or somewhere on the road to recovery. There is always support available. So, and we'll get to the so where's my closing slide? It's not coming up here for me. Yeah. Okay, so you should be able to see that as well. Full recovery is possible. There are the Bodywhys services. So Bodywhys have a helpline, and we also have support email. We have the online support group, an online support group for over 18s and under 18s. The Bodywhys website, the main website, with information relating to eating disorders and all of the different supports available. And also then we have a body image website, so with lots of different information to support people who are in recovery from an eating disorder, people who have body image concerns, and also information for parents then and for teachers. And we have a peer-led resilience program, which is a 4-week program for parents or anybody who is supporting somebody on their recovery journey. And then we have a range of different schools programs as well, and you can find out information about any of those through our website, and also information around how to contact the relevant person for additional details on how to sign up for any of those. Okay, so just to check in the Q&A the questions that we have. So whoever would like to answer this, is there anything that might be protective of body image and risk of eating disorder through the life cycle, example during puberty, pregnancy, or menopause? So whoever would like to take that.
I can take it.
Great.
If you like.
That's great. Thank you.
So one of the biggest protective factors for, in particular, the reemergence of eating disorder behaviors in midlife is the cultivation of body appreciation and body functionality. So positive body image. And when I say positive body image, I don't mean the Dove campaigns, love the skin you're in. Not that that's bad. I mean the cultivation of things that Aoife spoke about just there. 3 things that you like about yourself. And the repetition of appreciating what your body can do, hugging your kids, getting on a bicycle, going for a walk, getting up the stairs even, whatever it is, the thing that your body can do, receive connection, hugs from people, intimacy with people, and really kind of a daily practice of compassion towards yourself and emphasizing that repeatedly would be one of the key kind of evidence-based methods, I suppose.
And if I could just add to that, Sarah, because I think what we also sometimes forget about eating disorders, especially, is that one thing that you very quickly lose control of is also the surroundings and the social life. And an important protective factor is also peer support. You're on parents or family and your partner during pregnancy. And it's also an important part of actually helping women to be more acceptable for their bodies. And one part of doing that is also not being too focused on the body. Some articles has been describing how to emphasize how the body image, the positive body image, could be more embraced in a way, and it's also about using the body to forget the body. So body awareness is also about activating that you can actually experiencing your body being able to do stuff, not have just how it looks on the outer side, on the external part. And that is a good part about pregnancy that also talked about here, is that you could experiencing your body, and also maybe through birth. I have been talking to a lot of women that is suddenly experience that their body is strong in a different way, and they're actually able to give birth in a way that they didn't think they should be able to. So that's also a way of accepting your body, is also actually experiencing that your body is useful in a way.
That's great. Thank you very much. Would anybody else like to contribute there, or? No, thank you. Thank you both. Yes, and the next question, just to move on to, is how can health professionals support a person? Oh, sorry, I've asked that. Any considerations in relation to athletes' body image during pregnancy and throughout life?
You want to say something, Sarah, or should I start?
Go ahead, yeah, go ahead.
I think it's a lot of focus on the athlete's body and also during pregnancy. And I think the most important part here is trying to find out what the athlete body is about. Because I think very good things about the body being active and in a sport, but we also know that athletes is also a siblings to eating disorders, and is high risk also for having troubles with the body, because they're being too much focused on how the body is also should be looking in a way in some certain sports. But it could also be a very positive way of actually feeling more of the strong body through also pregnancy, and also a way of trying to get in a good dialogue together with the pregnant women, and also in trying to find out in an acceptable way what the body is able to tolerate, and how we could help the pregnant women to tailor their activities and training. And having a dialogue about it is much more useful than trying to tell people what they should do and what they should not do, because this is not something that we have a strict rules about. It's individual. So I think tailoring and being curious on how their body's working through pregnancy and afterwards is important.
That's great. Thank you, Bente. And I suppose something that comes up a lot in the research around body image and exercise is, that focusing exercise, if a person's motivation to exercise is focused on achieving a certain body image or body shape, that can have a negative impact on how people feel about their body image. Whereas if the focus instead, the motivation for exercising is related to promoting well-being, so that the person feels good about themselves, so they feel good in general, and then that tends to have a more positive impact on body image. And I suppose it's back to, tuning into what feels good for our bodies as well, and maybe tuning into our internal signals, interoception, but also what feels good for our bodies, and just appreciating what our body can do. So as Sarah said there, just going for that bike ride because you enjoy it, for the joy of it, or maybe dancing because you enjoy it, or being out in the fresh air and just enjoying the feeling of the air on your skin, and tuning into those kind of positive sensations and appreciating those aspects can help to support a more positive view of the person's body. So does anybody else want to come in there, or will I move on to the next question?
I think there was asked about what the health professionals can do, and I think what you're saying there is very important, because I think health professionals also have to remind ourselves that we have to be curious about the meaning of all these activities during pregnancy, for example, and ask more about how they feel and what they are comfortable in, more than just telling people what is the right and wrong thing to do. So I think it's a very important reminder to be curious about the women's actually experiencing of their bodies in different periods of life.
Yeah, that's great. Thank you very much, Bente. And just to, there's a few positive comments here as well I would like to share. So, thank you, Julie. So many important ideas in your story. Another person has indicated, love the talk today. Thank you all very much. And then, can I ask, Aoife, you mentioned going to group therapy. So somebody has asked, how did you, where did you get talking to other people with an eating disorder in a group environment? So if you were happy enough to answer that.
No problem. Hi, Kira. So I was going for counselling at the time, and it came to the fore that it was an eating disorder, and where I could get support, I suppose. And I was just guided to a few places in Dublin, and it just happened to be where I was living. I went to the Merino Therapy Centre in Drumcondra, which I'd highly recommend. And I know Bodywhys do group sessions as well. And I honestly, like, I was going because I suppose at the time I was like, I'm not investing money in one-to-one sessions because I didn't fully believe that I had one. I was kind of, okay, these are more cost appropriate ways that I'm going to go. And I thought it was going to be crazy, but it was honestly, I found doing the two together were amazing, but I learned so much from the groups and the power from hearing other people sharing their story, and you can relate to it. Like when you're keeping it all, there's so much shame and secrecy with the behaviors, with everything you do when you're wrapped up in an eating disorder. So I think hearing other people, I actually thought it was phenomenal, and I'd highly recommend it.
Great, thank you very much, Aoife. Another question. I have some teenage kids who are dealing with body shaping. Thank you for all the helpful tips today. Does anybody have any tips on managing group discussion to deal with this head on? I'd appreciate it. So if anybody wants to come in there.
Is this in like a school setting? Is it for a group discussion or just your own family?
The person's own family.
Okay. I suppose for me it would be, if I'm just putting myself in that shoes, what I would have needed when I was younger would be just to someone to listen, not someone to jump in and say, but you're not fat, but you're not this, but you're not thin. Like just to actually listen and how that made you feel, and I suppose just giving you that space to voice it, and I suppose giving you a hug, just reassuring you. But I think to move away from, oh, you're not fat, that's bad. Like, you know, that it's not that you're not putting any message between fat and thin or whatever it is, that you're just giving them space to voice their concern, and maybe, I suppose, asking them what do you like about your body, and what can your body do for you, and kind of bringing them back to that, and what ways can you respect your body. You don't have, like, finding out, do they like how they look, or if they're having issues with that, then I suppose it's not saying, you know, there's a lot of talk, and you mentioned the Dove awareness campaign and stuff, and it's like body love, and that is not, if you're in the depths of that, you're not going to be going there. But it's maybe, what can you do to respect your body, or what is there anything you like about your body, and trying to kind of build up those positive things, I think would be a good place to start, and bringing it back to respect, rather than body love. I suppose, what can you do to respect your body? What does your body do for you? That kind of thing.
Yeah, absolutely. Aoife, I would totally agree with you there. You know, so and I agree. It's not, you know, it's so important, isn't it, just to listen to what's going on for the child, to listen to what's going on for the young person, because whatever they're experiencing, whatever negative comments are coming towards them, you know, that's really affecting them. That's really impacting on them. So listening and then working together to come up with a solution. So what are the things that will help? Are there other negative influences? What are the things maybe that are contributing to them feeling negatively about themselves? And also, you know, seeing how can we maybe reduce the focus on body image in their lives, and how can we build up that bigger picture? So are there other things? Can we shift the focus a little bit away from body image? So we'll have that conversation. We'll try and kind of build up positive things there that maybe will support them to feel better about how they look, to feel, you know, to appreciate their bodies more, to be more compassionate in the way that they think about their bodies and talk about their bodies. But also, are there other areas of their life that they do really enjoy? Do they like horse riding? Do they like spending time with their friends? Do they love art? Do they love creative stuff? You know, and building up that kind of bigger picture as well, and letting them know that, you know, you love them exactly the way they are, you know, that that's who they are is so important, and the body image is really only one part, and maybe it doesn't feel like that when somebody's picking on them and making them feel bad, and when somebody else is focusing on that, but that's not them, that's, you know, that's not all of them, you know, how they look, and that's only that person's perception as well. So really important to kind of put it back in its place, I feel. But such a difficult situation to be in, and such a difficult conversation to have, isn't it? And we do have lots of support and advice around how to navigate those things on the Bodywhys body image website, and of course the option to contact Bodywhys for support to talk through the exact situation, if that's helpful as well. So just going to check in for time. We have 2 minutes, so I will just come to the last another question here. Hormones, PMT, PMDD, can these trigger your recovery and cause lapses, as I've experienced? So if anybody would like to come in there briefly on that. Anybody like to contribute there? Yeah, I suppose, you know, I 100% think that, yes, absolutely, hormones, PMT, PMDD can, you know, totally contribute to how people feel about their body image. To my mind, hormones can really influence absolutely everything. They influence our mood, they influence the way we perceive everything that's going on in our lives, and the way that we deal with other people. So they're so it's so huge, isn't it? I'm really glad that we have so much more of a focus on these things now, and that we're talking about menopause, as you talked about today, Sarah. And
Yeah,
Sarah,
I just might like to say that as well.
Yeah.
Fiona, is that, of course, there's enormous fluctuations in our primary hormones around the 40-ish bracket, and these have shown to really influence people's mood, memory, and concentration. So they have this profound, can have, not for everyone now, it's individually variable, on all facets of life. So there are some studies that have shown that there's kind of the re-emergence of an otherwise sort of almost dealt with, I don't want a better term for that, eating disorder, in and around the kind of the peri and menopausal transitions. And it's a real kind of period of a woman's life where, if you've already been experiencing eating disorders earlier on in your life, to be aware of that, that potential, again, another change, as Aoife was talking about earlier on, can have some challenges that come with it.
Yeah, absolutely, and totally affects our perception, everything. It's so hard to deal with things when our heads are overcrowded with hormones. Thank you. And there are supports available. I suppose there is information out there. So if people have particular questions about that, they can email us in directly, and I'll send out as many links as I can to support people on any of those aspects. So just finally, Aoife, I think you're answering there, are you, directly? And just another thank you there. Thank you so much, Aoife and Julie, for sharing your personal stories, and thank you all. So we've come to the end of our time today. Really wonderful to have you all here. I think it was a very inspiring webinar, really powerful. So wishing you all well. Thank you again for supporting Eating Disorders Awareness Week. And again, the hashtag is EDAW 2024. There are lots of different events on over the remainder of the week. You'll find all the links to those on the Bodywhys website. So thank you.